Hi viewers, welcome to my channel Healthy Topics. Myself Dr. Chandrasekhar, MD Physician, Certified Diabetologist working at another hospital, Ballari. So today I am very happy to inform you one of my viewers have asked in comment section regarding CVA, cerebrovascular accidents. Simple ಆಗಿ ಹೇಳಬೇಕು ಅಂದ್ರೆ stroke ಅಂತಾನೆ ಕರೀಬಹುದು. So we at our hospital we see day in and day out this type of cases, and we handle with interdisciplinary with other departments. ಏನು ಸರ್ ಇದು ಸ್ಟ್ರೋಕ್ ಅಂದರೆ ಏನು? ಸಿಂಪಲ್ ಆಗಿ ಹೇಳಬೇಕು ಅಂದರೆ ಇದನ್ನ ಪಾರ್ಸ್ ಅಂತ ನಾರ್ಮಲ್ ಆಗಿ ಸಾಮಾನ್ಯವಾಗಿ ಕರೀತಾರೆ. ಸೊ ವಾಟ್ ಈಸ್ ದಿ ಸ್ಟ್ರೋಕ್? ಇದು ಸ್ಟ್ರೋಕ್ ಅಂದರೆ ಸಡನ್ ಆಗಿ ಬ್ಲಡ್ ಸಪ್ಲೈ ಬ್ರೈನ್ಗೆ ಸಡನ್ ಆಗಿ ಸ್ಟಾಪ್ ಆಗಿದ್ರೆ ಒಂದು ಡಿಸೀಸ್. ಸೊ ಇದು ದಿಸ್ ಕ್ಯಾನ್ ಪ್ರೆಸೆಂಟ್ ಲೈಕ್ ವೀಕ್ನೆಸ್ ಆಫ್ ಅಪ್ಪರ್ ಲಿಮ್ ಅಂಡ್ ಲೋವರ್ ಲಿಮ್, ಆರ್ ವೀಕ್ನೆಸ್ ಆಫ್ ಬೋತ್ ಲೋವರ್ ಲಿಮ್ಸ್, ಆರ್ ವೀಕ್ನೆಸ್ ಆಫ್ ಬೋತ್ ಅಪ್ಪರ್ ಲಿಮ್ಸ್. ಅಪ್ಪರ್ ಲಿಮ್ಸ್ ಮತ್ತೆ ಎರಡು ಕೈ ಎರಡು ಕಾಲು, ಇಲ್ಲಾಂದ್ರೆ ಒಂದು ಕೈ ಒಂದು ಕಾಲು, ಯಾವುದೇ ಒಂದು ವೀಕ್ನೆಸ್ ಆಗಿ ನೋಡಿದ್ರೆ ಅದನ್ನ ಸ್ಟ್ರೋಕ್ ಆರ್ ಸಿಂಪಲ್ ಆಗಿ ಹೇಳಬೇಕು ಅಂದ್ರೆ ಪಾರ್ಸ್ ಅಂತಾನೆ ಕರಿತೇವೆ. ಸೊ ವಾಟ್ ಆರ್ ದ ರೀಸನ್ ಆರ್ ವಾಟ್ ಆರ್ ದ ಕಾಸಸ್ ಫಾರ್ stroke? Is most commonly it is due to the hypertension. Hypertension accounts for around 90% of the disease. Rest of the 10% is mainly due to blood problems like clotting disorders, patient on taking OCPs. Okay. So coming to this stroke, why is this stroke is very important? According to this new census data, it has increased cases in India due to increased life expectancy of the person, because as the patient develop old, they have a morbidity condition like hypertension or diabetic. So this stroke they basically divided into two types. One is what is called as ischemic stroke. Second is called hemorrhagic stroke. Ischemic stroke means there is a complete cessation of blood flow to the brain, part of the brain. A hemorrhagic stroke means there is a rupture of blood vessel, ಅಂದ್ರೆ ಒಂದು ರಕ್ತನಾಳ ಒಡೆದು ಬ್ಲಡ್ ಆಚೆಗೆ ಬರೋದು. ದಟ್ ಈಸ್ ಕಾಲ್ಡ್ ಆಸ್ hemorrhagic stroke. So ischemic stroke is further divided into what is called as embolic stroke and ischemia and embolic stroke ಅಂತಾನೆ ಕರೀತಾರೆ. So what are the complaints or what are the clinical features you see in stroke is, so basically you will have weakness of one half of the body. One half of the body will have weakness, and associated patient will have urination. Sometimes stroke is very dense, patient can have seizures, fits, adu kuda irbodu. Patient will have altered sensorium and associated features. Suppose it is due to cardiac problem, will have chest pain. Okay. So these are the basic clinical feature, or nothing much to elaborate in this topic. Why is this important? The time of onset to reach the hospital is very important. Please remember what is called as golden hour in stroke, that is less than 6 hours. ಒಂದು ಪೇಷಂಟಿಗೆ ಸ್ಟ್ರೋಕ್ ಆರ್ ಪಾರ್ಸಿ ಬಂದಿದ್ರೆ within 6 hours, if you are able to reach the hospital, you can salvage the part of the brain. Tumba important. So nearby hospital where there is a stroke care, please kindly reach and have a consult with the hospital where you can save the part of the brain. So ಏನು ಸರ್ ಇದು ಏನಕ್ಕೆ within 6 hours ಅಂದ್ರೆ, as you can see on the slide, there is what is ಕಾನ್ಸೆಪ್ಟ್ ಕಾಲ್ಡ್ ಪೆನಂಬ್ರಾ. ಅಂದ್ರೆ ಈಗ ಸ್ಟ್ರೋಕ್ ಒಂದು ಪಾರ್ಟ್ ಆಫ್ ದ ಬ್ರೈನ್ ಆಗಿರುತ್ತೆ, ಸೇ ಇಟ್ ಈಸ್ ಅರೌಂಡ್ ಸರೌಂಡಿಂಗ್ ದಿಸ್ ಅರೌಂಡ್ 5 centimeter, ಬಟ್ ಆಕ್ಚುಲಿ ಸ್ಟ್ರೋಕ್ ಆಗಿರೋದು ಓನ್ಲಿ 2.5-1 centimeter. But still on the imaging CT or MRI you will have a stroke. ಅದರಲ್ಲಿ ಒಂದು 3 centimeter of the brain can be saved if you are reaching on time. ಸೊ ದಿಸ್ ಈಸ್ ಕಾನ್ಸೆಪ್ಟ್ ಕಾಲ್ಡ್ ಪೆನಂಬ್ರಾ ಅಂತಾನೆ ಕರೀತಾರೆ. ಇದರಲ್ಲಿ ಕಂಪ್ಲೀಟ್ ಫ್ಲೋ ನಿಂತೋಯ್ತು ಅಂದರೆ ಪೇಷಂಟ್ ವಿಲ್ ಹ್ಯಾವ್ ಕಂಪ್ಲೀಟ್ ಸ್ಟ್ರೋಕ್ ಆರ್ ಪೇಷಂಟ್ ವಿಲ್ ಹ್ಯಾವ್ ಮೈಲ್ಡ್ ವೀಕ್ನೆಸ್ ಆಗಿ ಪ್ರೆಸೆಂಟ್ ಮಾಡ್ತಾರೆ. ಓವರ್ ಎ ಪೀರಿಯಡ್ ಆಫ್ ಟೈಮ್ 24-48 hours ಆದಮೇಲೆ ಇನ್ ಹಾಸ್ಪಿಟಲ್ ಫಾಲೋಯಿಂಗ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಪೇಷಂಟ್ ವಿಲ್ ಗೋ ವಾಟ್ ಈಸ್ ಕಾಲ್ಡ್ ಸ್ಟ್ರೋಕ್ ಇನ್ ಎವಲ್ಯೂಷನ್ ಅಂತಾನೆ ಕರೀತಾರೆ. ಸೊ ಇಟ್ ಈಸ್ ನಾಟ್ ಡ್ಯೂ ಟು ದ ಟ್ರೀಟ್ಮೆಂಟ್, ಇಟ್ ಈಸ್ ಡ್ಯೂ ಟು ದ complete cessation of the blood over a period of time. ಸೊ ಇಲ್ಲಿ ಬ್ರೈನ್ ಅಲ್ಲಿ ಸ್ಟ್ರೋಕ್ ಆದ್ರೆ ಪೇಷಂಟ್ ವಿಲ್ ಹ್ಯಾವ್ ಟೂ ಟೈಪ್ಸ್ ಆಫ್ ಬ್ರೈನ್ ಪ್ರಾಬ್ಲಮ್. ಒನ್ ಈಸ್ ಕಾಲ್ಡ್ ನೆಕ್ರೋಟಿಕ್ ಪಾತ್ವೆ ಅಂತ ಹೋಗ್ತಾರೆ, ಇನ್ನೊಂದು ಅಪಾಪ್ಟೋಸಿಸ್. ದಟ್ ಈಸ್ ಸೆಲ್ಸ್ ವಿಲ್ ವಾಟ್ ಈಸ್ ಅಪಾಪ್ಟೋಸಿಸ್ ಇಸ್ programmed cell death. Once you have a decreased sensation, the cells will shut down itself. That is called apoptosis. In necrotic is due to the inflammation of the brain. Okay, so patient ಈ ತರ ಒಂದು patients stroke ನಾವು in our hospital we see regularly and we manage it meticulously under in the ICU. So coming to the management, ತುಂಬಾ ಇಂಪಾರ್ಟೆಂಟ್ ಆಗುತ್ತೆ. ಫಸ್ಟ್ ಅಂಡ್ ಫಾರ್ಮೋಸ್ಟ್, you reach the hospital, you don't need any medication. So once you reach the hospital, get emergency CT to rule out whether it is an ischemic stroke or hemorrhagic stroke. So why is this is you need to add what is called antiplatelets if you have a ischemic stroke. If you have a hemorrhagic stroke, you are going to monitor the BP. So usually suddenly within 24 to 48 hours, BP you should not reduce unless it is more than 180/100. So then only you can give antihypertensive. ಏನಕ್ಕೆ ಅಂದರೆ once you reduce the BP, the whatever the high pressure maintaining the blood flow to the brain, if you reduce the BP, it will get completely cessation. So that's why we ideally in my practice I won't reduce the BP unless it is more than 180/100 and in patients with hemorrhagic stroke. And also patients with stroke will have fever and elevated sugars. This should be controlled very meticulously. Fever with stroke again have very poor prognosis, and hyperglycemia further increases the size of the stroke. So and the second, you should maintain lipids also. Lipid profile also should be maintained. LDL should be maintained less than 70. And sugars in ICU should be maintained less than 180, irrespective whether is a diabetic or non-diabetic. Coming to the treatment aspect, if you reach within 6 hours and came to know it is an ischemic or embolic stroke, you can give what is called tenecteplase, TPA. It is given for IV stat dose followed by infusion. So those stroke treatment is not very much needed for this video. However, what are the prevention for this stroke is whoever known diabetic or hypertension, please kindly get checkup regularly every 2 to 3 months and control your weight, avoid smoking, avoid alcohol, and whatever the medication the registered practitioner has prescribed, please kindly have it. And once you develop stroke, it should be taken minimum for 1 to 2 years and later it is assessed. So this is the topic want to discuss regarding stroke. Thanks for asking, and thank you for watching this video. And at last I've reached subscribers nearly to 500 odd, and I thank everyone who has supported this channel, and hope in coming future I have come with very good content, and thank you.